So welcome everybody. My name is Anna Stroll. I'm one of the gynecologic oncologists here at Northwestern. And I want to thank everyone for joining us tonight for our first ever Gynecologic Survivorship Mini-Symposium. When we planned this event last year, our hope was to create a biannual event that we could bring together gynecologic cancer survivors, provide updates on advancements in our care and in clinical trials, provide education, and celebrate the women and their families whom we care for every day. As many other things these days, these plans were quickly sidelined by the COVID pandemic. However, we thought it was too important of an event to forego, so we pivoted to create this virtual event. Tonight, we hope to provide you all with an overview of updates and advancements in the treatment of all gynecologic cancer types, as well as highlight the challenges of a cancer diagnosis and treatment in the time of COVID-19. This evening's event will consist of a keynote address by our very own Dr. Tim Pearman, focused on navigating cancer in the time of COVID. Following his address, we'll be holding 30-minute breakout sessions specific to different cancer types. We will conclude tonight's event by rejoining together for a panel discussion where we will have time to answer your questions. In terms of some housekeeping, I just want to remind everybody to keep their videos and microphones off. Only the speakers will have these tonight. There will be a panel discussion at the end of the evening, so please submit any questions to the speakers by using the chat feature that you can see on the bottom of your screen. You can submit questions throughout any time during the evening. For questions for Dr. Pearman, we will answer those at the beginning of the panel. And for questions from the breakout sessions, we will answer those towards the second half of the breakout panel at the end. Dr. Tanum will use these questions to moderate the panel. We know that there will be many questions and we won't be able to get them up to all of them throughout the evening, but we'll definitely do our best. So without further ado, I would like to turn our attention to the focus of this evening. It's my great pleasure to introduce our keynote speaker, Dr. Tim Pearman. For those of you who have not yet had the pleasure to hear Dr. Pearman speak, you are in for a great treat. We are so fortunate that he's agreed to join us tonight. Dr. Pearman is the director of the Supportive Oncology Program here at the Robert H. Lurie Comprehensive Cancer Center as a board-certified clinical health psychologist. His accolades and accomplishments are endless, but to name a few, he has served on the NIH Health Disparities and Equity Promotion Subcommittee, as well as the National Comprehensive Cancer Network, or NCCN's Distress Management Expert Panel, and is the disease section leader for quality of life for the Scientific Review Committee within the Cancer Center. He specializes in cancer survivorship, quality of life, and focuses his career on helping patients cope with the psychological stressors that come with medical illness and cancer. So tonight, we have the distinct pleasure of hearing him speak on navigating cancer in the time of COVID-19.
Well, thanks so much. I really appreciate those kind words, Anna. It's wonderful to be here. Thank you for inviting me to do this. I will share my screen so that you guys can see my slides as I go through this, and I'll look forward to answering any questions, as Anna said, at the end during our panel discussion. So thank you again for having me. Anna and Dr. Tanner and everybody was really kind to invite me to talk a little bit about how we can sort of navigate cancer and cancer treatment during this crazy time with the COVID pandemic. And so I just want to spend a little bit of time tonight talking about how we can sort of provide a framework for understanding the really complex emotions that I think everybody has during this time, and how to manage the complex stressors of both cancer and COVID, and talk about some really practical approaches to hopefully manage these emotions. So, as I'm sure I'm preaching to the choir here, but we all have really complicated feelings when we're diagnosed with a potentially life-threatening illness like cancer. So anger, guilt, sadness, fear, uncertainty are unfortunately the norm when we're coping with cancer and cancer treatment. But these feelings are also really highlighted when we're faced with this global pandemic during the COVID crisis. But oftentimes we just don't talk about these feelings. And I've had a lot of people that I work with say things like, you know, I feel like I'm just being a complainer. I have such a good family and I have such a good, group of treatment providers. Like, what do I have to complain about? And so instead of talking about some of these complicated feelings that we have, a lot of times we just try to bury them or push them aside. And I think that's a real disservice to us and also to our family and friends. And I think this really starts with our attitude toward cancer, COVID, our medical conditions, our medical care. And so I've shown this slide a number of times when I've been presenting in person, pre-COVID, to people. And I've asked the audience to raise their hand if they feel like they've ever gotten this message from someone that they know. And almost inevitably, every hand in the audience goes up, because I think everyone who's diagnosed with cancer gets this message of staying positive, thinking positive, being positive. That message gets pushed out to you from the moment you're diagnosed throughout the course of your treatment and survivorship. And I actually had a mentor of mine who was a psychiatrist at Sloan Kettering in New York, whose name was Jimmy Holland. And she wrote an article one time that was called "The Tyranny of Positive Thinking." And I love that title because the reason that she called it the tyranny of positive thinking is, she said, it's completely unrealistic to think that you could be diagnosed with a potentially life-limiting illness and stay positive all the time. Like, that would be a crazy reaction, right? And so she felt like this message of staying positive and positivity was really misguided. Like, it was well-intentioned, but it was misguided. And she felt like it could lead to people feeling really guilty that they weren't coping well, that maybe because they had some times when they felt really down or really sad or really anxious, maybe they were contributing to their cancer progressing or cancer recurrence or something in that nature. And so she felt like it could really lead to a lot of guilt and unintended consequences. And so I think if you take away one message today, I think it's this: it's really healthy from a psychological perspective to have both painful feelings and also of gratitude, happiness, appreciation about the life that you have today. And it's okay to feel those really conflicting feelings when you're diagnosed with cancer. And again, those are just magnified and highlighted during a crazy time like the time of COVID. So the other thing to point out is that for most of us, we typically cope with sort of a problem-solving approach. So we tend to focus on what's caused this problem, what are some of the potential solutions, and how can I reduce or eliminate that source of stress. And typically this is a really good approach. It's very practical, it's very adaptive, but the problem is this strategy works the best when the stressors are controllable. So if you have work stress, if you're getting bullied by a boss or a coworker, you can kind of identify, okay, this is exactly what the stressor is about. These are some strategies I could take. I could go to HR, I could talk to the person directly, and then kind of come up with a solution from there. But cancer and COVID are really different in that a lot of the stressors inherent in dealing with these conditions are not controllable. And so it leads to some difficulties when we take this problem-solving approach. So what can we do differently about this? I think the message that I want to give to everyone is, I think it's really important to focus most of our time and energy on the things that are controllable or potentially controllable in our lives, and to push the uncontrollable things to the side. That doesn't mean that the uncontrollable things are not going to be distressing, that they're not going to stress us out, that they're not going to pop up from time to time, but it just means that we're not going to give them more of our time and energy than we need to, and that we're going to focus most of our time and energy on the potentially controllable things. So the first thing that I'm a huge proponent of is physical activity, is exercise. This slide is it's the American Cancer Society guidelines for physical activity. And as you can see, they're fairly general guidelines. They say that most adults should engage in 150 minutes or more of moderate exercise per week. And moderate exercise, for those of you who don't know, is kind of like if you're walking at a brisk pace and you're a little bit out of breath, but you're not having trouble finishing the walk. That's moderate exercise. So one of the questions that I get asked a lot when I recommend this to patients is, okay, so what exercise should I be doing? What's the best kind of exercise? What is the premier exercise that I should be doing? And I will typically turn that back in a question to the person I'm working with and say, well, did you ever have a specific exercise regimen, a specific kind of exercise that you really liked? And if so, go back to that. Because if you go to, say, PubMed or even a Google search and type in cancer and exercise, you will find every possible exercise that you could, from the things that you would probably expect, like moderate intensity walking, yoga, up to things like kickboxing, Zumba classes, Wii Fit, Frisbee golf I saw recently. And interestingly, almost to a study, all of those exercise approaches have been found to be helpful. So it really doesn't matter what kind of exercise you do. It's just important that you keep moving, find something that you enjoy and stick to it, and do it at least 3 or 4 times a week if you can. The second thing is nutrition. And again, this is the American Cancer Society guidelines for nutrition, but they're very general. And so, like take this second bullet point, limiting the amount of processed meats and red meat. My wife, who's a vegetarian, will often joke that when we go to visit my family, and my family is very Southern, when we go to visit them, she jokes that we can spend an entire weekend with them and not have one meal that doesn't involve bacon or pork or red meat. And she's kind of right about that. So if you come from a family like mine, this second bullet point might mean, well, I'm going to cut down my red meat from 3 meals today to 2 meals today. And that's probably still too much red meat. So don't take these like general recommendations at their word. It's really important to utilize the resources that you have where you get treated. So here at Northwestern, for instance, all of our patients have access to the full range of supportive providers, and that includes dietitians, social workers, psychologists, psychiatrists, health educators, patient navigators, fertility preservation. All of these services are available to you, so don't hesitate to reach out if you have questions about something like nutrition. If you're gaining weight, if you're losing weight, if you're not sure how to formulate a diet that's appropriate for you and your cancer treatment, definitely ask your doctors, your nurses about this, and we can provide that kind of consultation. The third thing is stress reduction, and obviously stress reduction means different things to different people. I think everybody has their own ways of reducing stress in their lives, but overall, I would say that engaging in activities that make you happy, that provide some joy, and that actually give you some social outlet is the most important thing. And obviously the social part of this is really difficult during the time of COVID. But I think probably everyone would agree that, our society has gotten pretty resourceful when it comes to the social activities, and doing things like Zoom happy hours, meeting on Microsoft Teams with your friends and colleagues is a pretty normal thing nowadays. So definitely avail yourself of those activities. The other thing I would say is some of these like specific relaxation techniques like meditation, guided imagery, breathing exercises, those can be really important for actually reducing just our somatic distress, so the impact of stress on our bodies. And I want to mention, and we can talk about this more during the panel discussion at the end, but one of our donors to the Cancer Center is actually the owner of Chill, which is a meditation studio in Chicago. And they have a wonderful app that you can actually do live meditation classes, live classes that focus on deep breathing techniques. And these classes are anywhere from 5 minutes up to 60 minutes. And you can also dive into their library of pre-recorded classes as well. And they've offered this to all of our patients and actually all of our faculty and staff as well for the rest of this year for free. So I can give anyone the information about how to register for the free classes in the app after this is over. So definitely don't hesitate to avail yourself of those kinds of things that I think can really help when you're trying to learn some of these relaxation techniques. I think the final thing I would talk about in terms of the controllable stress management techniques is compliance with medications and treatment. And obviously, you know, the clear benefits of being compliant with our treatment is that, you know, when we're not compliant with treatment or medications, it can lead to decreased survival time, higher recurrence rate, more progression of disease, increased healthcare costs, because a lot of times you might need to go to the ER more frequently, you might have more inpatient admissions. So there's a whole cascade of impacts that not being compliant with our medications and treatment can bring to the fore. But I think maybe the most important part of this is just that focusing on being compliant with medications and treatments is one thing that we can do in our cancer journey to feel more in control. Again, there's so much of this journey that feels out of our control, that this is one thing we can do to really have some agency, to take control of our journey, and to make the future part of what we've done. And so this brings us to kind of the topic of compassion for ourselves. So compassion is, like it says here, it's not finite. It's not a zero-sum game. I think it's really easy to be compassionate to our family, to our friends, even to the society that we live in now. But it's not always so easy to be compassionate towards ourselves and to accept that we have these difficult emotions. We are difficult, complex creatures, and sometimes the emotions that we feel are as complex as we are. And so I think if your version of compassion doesn't include you, then that's something to kind of tap yourself on the shoulder about, remind yourself when you feel like you're being really hard on yourself. And I think once we accept that we are complex, we do have complex emotions and feelings, it's a lot easier to clarify our priorities and say, what are my values? What are my personal strengths? What do I want to do more in my life? What do I want to do less of? I actually met with a patient just yesterday who is 50 years old. She has 2 grown kids. She has stage 4 cancer. And she said, you know, my value, like who I view myself, the lens I view myself through is as a caregiver. And she said, you know, I've taken care as a single mom for both of my kids. They've turned out great. They're now adults. They're on their own. I actually quit college because I was taking care of my grandmother who had Alzheimer's. I nursed her through until she passed away. And I knew that I always wanted to be a marriage and family therapist. That was her goal. And it very much fit in with her values and her strengths. And so she's decided now that she's going to go for it at age 50. And so she's gone back, she's completed her prerequisites, she's completed her undergraduate degree, and she's now taken her GRE test, and she's going to go to graduate school and become this. So I think that's an example of kind of how cancer and COVID and all of this uncertainty can help us to clarify our priorities. And for other people, it may be a really different equation. So I've had a lot of people say to me, you know, I realized before I was diagnosed with cancer, I was spending 60 hours at the office and I was really neglecting my kids and my family. And I've decided that I can get my job done in 40 hours and I can pay more attention to my family. And that's the value that's really meaningful to me. And so I think that really can kind of help us to create meaning in our life and to choose the things in our lives that are really high priority for us to align with our values, to develop these goals, and then to finally take action and actually make these things a part of our lives in the here and now. But I think in order to do that, it's really important to kind of be present. And what do I mean by that? Well, the word mindfulness always comes up, and I know that that is such a buzzword in our current culture. I think, you know, we all hear mindfulness, mindfulness, mindfulness. But if you ask anyone, what is mindfulness? I think most of us wouldn't really know what mindfulness is. And this researcher, John Kabat-Zinn, was one of the first people to really do a deep dive in a research sense and explore how this practice of mindfulness can improve quality of life, can improve health outcomes, can improve relationships. And so he defines it this way, that it's basically really paying attention in a really intentional way to the here and now. And I think the best graphic that I've seen that sort of illustrates this, I think, is this. And I have a dog, and anybody else who's on this call that has a dog, I think will agree with this. When I walk the dog, oftentimes my mind is full of hearing the super loud ambulance and fire trucks that are going by, and thinking about what I have to do at work, and, you know, all these other kind of stressors and lists of things to do that we need. But my dog is definitely focused on, oh, there's another dog. Oh, here's another pee spot that I can sniff. Like, very focused in the present, in the here and now, in a way that I have a really hard time doing. And so I think the more that we can get to that sort of puppy mind, the better. But that's obviously a lot easier said than done. And so again, I think this all starts with our breathing and with paying attention to our body's signals. And so I think something like the Chill app that I mentioned, or going to a meditation class, or if you even go just to the internet and do a search of deep breathing, you will come up with hundreds, if not thousands, of videos that can teach you how to do this breath work and this kind of body scan. But the short version of this is it's really important to breathe deeply, breathe slowly, pay attention to your breath, and also to notice from head to toe where your stress lies. So when we're stressed, we tend to breathe more shallowly, we tend to breathe quicker. You may notice that your body tenses up and tightens like this, your shoulders come towards your ears, you may have headaches, those kinds of things. And so it's really important to pay attention to what your body is doing and try to just take a moment and breathe deeply and sort of relax your body physically. And it's also really important to just notice these things without judgment. We're all susceptible to stress and the impact of stress. And so there's a lot that we can do with this, but there's no judgment. It's not that if you're feeling really tense and tight and in a shallow way that you're not coping well. That's not it at all. We're all susceptible to those things, and it's okay to just accept that. And so again, being present gives us kind of an awareness of our experience. It allows us to feel these really complicated feelings without judging ourselves. And then it can kind of help us to manage this stress longer term. And so I know I'm about out of time, but I think just in sum, it's really important to just appreciate that we are complicated people, we have complicated feelings, and that's okay. And we can be compassionate toward ourselves, to understand and to give ourselves permission to not be okay. This is a really difficult time for everyone. And once you've been diagnosed with cancer and going through cancer treatment, and then you have COVID on top of that, and you have to socially distance and do all of those things, it only becomes more complicated. And so to have the compassion for yourself that it's okay to not be okay, I think it's a really important skill for all of us right now. And then I think just being able to sort of identify some things that make your life meaningful right now, whether that's focusing on a goal that you've been putting aside for a number of years, or whether it's focusing more on time with your closest family and friends, whatever it is that creates meaning in your life, I think that's really important during this time. And the final thing is just reaching out for more help if you need it. So if you do feel like you're having prolonged periods of distress, whether it's depression, anxiety, insomnia, fatigue, let your doctors and nurses know, because oftentimes there is a really straightforward, simple solution for these things. And we certainly have the availability in terms of our supportive services here to help with those things. And I put this last slide up just because I know everybody's going to have access to a copy of this slide deck. So these are some really good resources for cancer survivorship. All of these resources have some sections in them about self-care and how to manage cancer survivorship from the time of first diagnosis through treatment and into the follow-up period. So don't hesitate to look at some of these resources as well. And I will look forward to answering any questions during our panel discussion.